Good afternoon, and thank you for having me here today, and hello to those of you online as well. So my name is Sally, and I'm the National Training and Research Coordinator at Action on Postpartum Psychosis, or APP. So APP is the UK national charity that supports women and families affected by postpartum psychosis. We offer life-saving peer support, information and resources. We help train health professionals, facilitate research, raise awareness and campaign for better services across the UK. So I'm here today to talk to you about our antenatal awareness campaign we've been running over the last year. Unfortunately, Naomi can't be with us today, but I just want to acknowledge that as well as all the other colleagues in APP, Naomi's been heavily involved in this work and I'll be presenting on behalf of her today, so she's sorry she couldn't be here today. So my background is in academia as a lecturer and researcher in health and exercise sciences. In 2015, I gave birth to my daughter, Ella. I'm not going to go into too much detail about my experience because I could be here for days talking to you. But just in brief, in the hours after giving birth via emergency C-section, I came round and I was quite confused. I couldn't make sense of time. I didn't really know what was going on. My brain was on overdrive and I was manic. I couldn't sleep for some reason and I knew that something wasn't quite right. So I was admitted to a general psychiatric unit 5 days after Ella was born and diagnosed with postpartum psychosis. So this picture on the left here is of me and Ella in the psychiatric unit when she came to visit me. And due to lack of specialist services at the time when I was ill, Ella's 8 now, it did take a long time to access the right treatment for me. And at the time that was antipsychotics, anti-anxiety medication and antidepressants, and eventually electroconvulsive therapy or ECT. So it meant it took a long time to recover from the illness and had to work through lots of things that happened over the last few years. But the midwives who were on the labour and postnatal wards at the time played a huge part in my journey. And I probably wouldn't be here today talking to you without them. So I just wanted to point out a couple of things from my journey. The first is that I had no previous psychiatric history, so this was completely out of the blue for me. And secondly, myself, family and friends had never heard the words postpartum psychosis before, so we were suddenly plunged into an unfamiliar world of severe mental illness. So never having heard about postpartum psychosis or not having information beforehand is not uncommon for people that have been through postpartum psychosis. So I just want to show you some other examples of women and families from APP. So here we have Sarah on the left-hand side, who had a history of mental illness. However, she says that no one asked about her mental health history and no one told her that she was at greater risk of postpartum psychosis. So we know that for those with a history of bipolar or previous postpartum psychosis, they're at significantly higher risk of developing postpartum psychosis. And then on the right-hand side, you can see here the impact of not knowing about postpartum psychosis can have on partners and the wider family. So Vlad says he felt completely helpless, and if he'd only known about postpartum psychosis, then he might have been able to get help more quickly for his partner. And he says the whole time was a living nightmare for all of us. So many families affected by postpartum psychosis tell us that they wish they'd known about the symptoms to look out for, how quickly things could escalate, and how to seek urgent help. So partners and family members often describe witnessing their loved one's symptoms as terrifying, and many struggle on alone in those first few days and not really knowing how to seek help. So their plea to the antenatal education providers is simple, that parents need to know enough about postpartum psychosis so that they can reach out for expert help more quickly. So APP has supported thousands of families through the shock and trauma of experienced postpartum psychosis and have been campaigning to raise awareness and training health professionals involved in perinatal care. But in 2021, APP conducted a YouGov survey to find out about the awareness of postpartum psychosis in the general population. So the poll found that 61% of the population had not heard of postpartum psychosis. And then when we asked whether expectant parents had been given any information about postpartum psychosis in antenatal classes, only 6% said they had. So why is it important to know about postpartum psychosis? So not only does the delay in recognising the symptoms of PP cause delays in treatment and lifelong trauma, unfortunately, we know that suicide is the leading cause of maternal death within the first year after giving birth. And at APP, we've supported families of those who did not survive postpartum psychosis. So because of this and the anecdotal evidence in APP, in 2022, we launched our antenatal campaign to raise awareness of postpartum psychosis amongst health professionals and expectant parents. So in July, earlier this year, we launched a survey that asked different antenatal professionals to share their views on whether they talk about postpartum psychosis with expectant parents and what their views were on why they did or didn't do this. So over 160 maternity and midwifery professionals took part in the survey. And you can see here on the left-hand side that 88% of professionals surveyed believed it was important to share information about postpartum psychosis. Interestingly, more than 50% of providers said they mention postpartum psychosis, which is significantly more than the 6% of expectant parents who said they received the information in antenatal classes. And that's probably because we have a slightly biased sample. So we were probably in contact mostly with antenatal providers that have heard of APP and therefore probably have an interest in perinatal mental health and postpartum psychosis. And some of them were perinatal mental health specialists as well. So the YouGov poll might be more representative of the general population and providers. However, in our survey, we found that nearly 30% of the respondents said they don't mention postpartum psychosis in their antenatal classes. So this slide just explores the reason why some antenatal providers don't talk about PP, which are listed on the left-hand side in order of frequency. So the top reasons were, I don't want to frighten women and their partners, time is limited, and I don't know enough about the condition myself. So we have also presented some qualitative quotes as well on the right-hand side, and you can just see in relation to these themes. So there's a real fear of scaring parents and causing more anxiety in expectant parents, which is understandable. But delivering this information in the context of perinatal mental illness, the signs and symptoms to look out for, and that women do get better if treatment is sought quickly, can actually reduce stigma and ultimately it can save lives. In terms of time being limited, we agree there is so much information to cover for expectant parents, and as midwives you have to cover everything and you just can't cover everything. But there are other maternal illnesses and conditions that the general population are much more aware of, such as postnatal depression, baby blues, preeclampsia, and Down syndrome. So although some of these are more common, postpartum psychosis is a severe illness that can be life-threatening. And importantly, we know it can happen to any new mother. So the most common reasons why antenatal providers do talk about postpartum psychosis are listed on the left again. And these were mental health is just as important as physical health, that all families should know how to get help quickly, and that it can happen to anyone out of the blue. So some of these themes that come out in the quotes as well included that it's a medical emergency, it's a cause of maternal death, it can reduce stigma, and knowledge is power. So we're continuing to analyse this data from the survey just to look at the different responses across the different health professionals, so whether it differs against midwives or perinatal mental health practitioners or NCT, different organisations. And also trying to look at developing resources to start having these conversations with parents, expectant parents. So really the conclusions from this survey are that not all antenatal providers talk about postpartum psychosis in their education classes. And the main reasons for that is not wanting to scare parents, that they don't have time or they don't fully understand the condition themselves. So these results are going to help us provide that guidance to developing these resources for the future. So just very briefly, what do we already know about postpartum psychosis and what resources are already available? So we know that postpartum psychosis is a severe, frightening postnatal mental illness, which has a rapid onset, so that can happen within hours of childbirth and in the first few weeks of childbirth. And it's considered a medical emergency. So a woman can go from being quite well to needing psychiatric care within a couple of hours. So it affects 1 to 2 in 1,000 new mothers in the UK. So that's about 1,500 new mums across the UK each year. And just around here in Scotland, it's about 100 a year. So symptoms include mixed mood, so feeling quite high and low, but that rapidly changes. Confusion or kind of disorientation, not really understanding what's happening. And then leading to delusions and hallucinations, so seeing and hearing things that aren't really there. We've also done some work in APP in terms of spotting those early signs and symptoms, and there's quite a lot of information on our website about that. So what are those kind of early signs and symptoms leading up to that full-blown psychotic episode? And those are things like feeling anxious, the kind of spiralling mind and racing thoughts and mind being very busy. So do have a look at those, because that helps you just kind of recognising those symptoms in the early days. So in terms of treatment then, ideally, a mother will need to be admitted to a specialist inpatient mother and baby unit, ideally with her baby, so she can recover with the baby. Medication, and then access to psychological support and practical help with caring for the baby. And then more in the long term, in terms of long-term recovery, it can be a bit more complex depending on different individual needs, but there'll be lots of different health professionals involved in that woman's recovery. So whether that's health visitors, midwives, specialist perinatal mental health teams, and then access to psychological support and peer support to kind of recover from the emotional side of everything that's happened. And meeting women that have been through it as well is really helpful. So I guess the positive thing to take from this is that with the right access to treatment quickly, women and families can be expected to make a recovery from postpartum psychosis. And that's the thing to hold in mind, that there is hope there. And I guess if you remember one thing from today is myself stood here talking to you, having recovered from a severe mental illness. So in terms of our existing resources, on our website we have lots of information for health professionals, including guides on recovering from postpartum psychosis, a guide for partners, and then a guide for those at a risk of developing postpartum psychosis. So for example, those with bipolar history or those with a previous PP. So please take a look at these, and you can request free copies by getting in contact with us for yourselves and for any patients as well. And then the graphic on the right-hand side, infographic, is just something that we launched during COVID to help health professionals and families and friends of new mothers to look out for signs and symptoms and what to do if you think someone's developing postpartum psychosis. So lots of resources on our website. So alongside our training resources, we are in the process of developing these resources for antenatal providers. So we know from the survey that people wanted the signs and symptoms of PP and what to look out for, information about PP and why it's an emergency and how and where to get help, information on recovery from postpartum psychosis and what the chances are of getting PP and what the risk factors are, and then how to talk about all this with expectant parents. So they also reported that they would prefer these resources in fact sheets, so some kind of examples of top 10 tips or infographics would be really helpful for new parents. And that also videos and YouTube sites and maybe modules of lived experience stories that parents can look at in their own time, or that they could look at in their own time as well. And then we also asked when they felt this information should be delivered. So the most common answers were in the last trimester of pregnancy, at NHS antenatal and NCT classes, and then in the information packs given at birth, and then the postnatal check by midwives and health visitors. So later on in the pregnancy and in those early few days of birth. And then for those that have a history of severe perinatal mental illness or that are at risk of PP, they would need that information probably earlier in their journey. So just a couple of things that you can do is that you can sign up to our campaign and receive updates and access to the new resources when we launch them. And that's at antenatal@app-network.org. And then please do get in touch with us in terms of training if you want any information on our training at app-network.org. If you'd like to find out about our kind of current options, we have lived experience talks and kind of more in-depth one-day training sessions. So I'd just like to end this bit by saying, please keep in contact with us and connect with us. Without people like yourselves, I probably wouldn't be stood here talking to you today. So thank you for everything you do for women and families. And by talking about perinatal mental illness, we can help reduce the stigma and trauma for women and families and ultimately save lives. So thank you for listening.